Good Samaritan Hospital, we've pioneered medicine for 170 years, outwitting diseases, caring for millions of patients, and preparing doctors to heal, even in the most unexpected circumstances. No matter the obstacles facing human health, we create ways to overcome them. Bold breakthroughs, compassionate care, revolutionary results. In the fall of 2022, Good Samaritan Foundation will publicly launch Forever Forward, the largest comprehensive fundraising effort in the hospital's history.
Hello, my name is Kip Heekin, and I'm the current chairman of the steering committee for the Forever Forward campaign and chairman of the Good Samaritan Foundation Board of Trustees. Forever Forward is about people, about beliefs, community, and resiliency. As healthcare innovation provides hopeful new therapies, surgeries, and treatments, our community's ability to access those advancements will write our future. Forever Forward is a relentless commitment to the Good Samaritan way of compassionate care. Today, Hamilton County and our surrounding areas suffer from a huge gap in health equity. The inability of our community's most vulnerable citizens to overcome economic, educational, environmental, and social constraints plays out in far worse health outcomes every day. Life expectancy at birth varies by up to 20 years for residents in bordering neighborhoods. Solving this problem will require new, proactive models, partnerships, and prevention. However, it requires something more. We must also combat this problem through access, innovation, patient experience, and doubling down on our strengths. Expert care for women, cancer, neuroscience, and advanced surgery. Investing in infrastructure will allow us to maintain a strong healthcare hub, providing communities like ours something unique: the ability to access care without the risks and inconvenience of travel. But it also does so much more. It provides a learning environment to train the doctors and nurses of tomorrow. It enables collaboration, which leads to better outcomes. It assures that the very best talent can be recruited and retained. It provides a home for the very best technology and patient-centered environments to exist. It strengthens the local community, and perhaps most importantly, it ensures that the true stakeholders in our community, our neighbors, forever remain the focus of our healing ministry. Over the next 5 years, Good Samaritan Hospital will undergo an evolution, motivated by our mission to serve, a modernized, much-needed, state-of-the-art healthcare facility that will better meet the evolving needs of our community. Facility advancements and infrastructure will total a $260 million investment into the lives that we serve every day. Beginning with the new ambulatory and surgical center, relocation of the Cancer Institute, along with expansion and growth of the Cancer Institute and Heart Institute, a relocation of the emergency department, centralized ambulatory diagnostics, an easier wayfinding experience for patients and families will streamline access to critical care.
Why this project? Why now? Today, our campus encompasses more than an entire city block. During and after the pandemic, Good Samaritan remains our community's lifeline. Many of the physicians and nurses who work in this urban setting hospital see that choice as a calling. It's that guardian spirit that makes this facility so special. However, healthcare moves at a fiery pace. It is no longer feasible simply to renovate. It's time to rethink. We believe we have an obligation to care for the next generation, as we've done for 170 years. Large-scale change is necessary, and it's urgent. Philanthropy can accelerate and enhance this project in a way that operational dollars alone cannot.
Healthcare continues to evolve at an incredible pace. Advancements in research, technology, innovation, and patient-centered care have changed how we think, feel, and experience care. The simple truth is our facilities have begun to age out. Our facilities and care must become state-of-the-art. It is no longer cost-effective to renovate. Certain buildings will need to be raised, others rethought, and new buildings constructed. This new collaborative vision is to recreate an inspired, far-reaching, sustainable, and energized health campus that can serve this community for the next 50 years. A vision, an obligation to continue our Catholic mission, started by the Sisters of Charity 170 years ago. Our mission is to continue the healing ministry of Jesus, like the Good Samaritan being moved with compassion. We continue the legacy of the Sisters of Charity and ensure cost-effective, caring, compassionate health for our region and for future generations. Yes, Good Samaritan continues to live as a family, a beloved community with care and compassion for a lifetime.
Access is about providing our community with safe, convenient, affordable, and high-quality care close to home. As a tertiary hospital, we serve the entire community. Making care accessible to all is the first step. This new campus is being designed with innovation at the forefront. A place where current and future technologies will ensure a healthier community and save lives. Through the creation of modern spaces, patients will experience better wayfinding, soothing environments, and an overall sense of healing that matches the compassionate care provided by our doctors and nurses.
Hello, my name is Dr. George Karlakian, and I'm the chairman for the Department of Surgery at Good Samaritan Hospital. Good Samaritan Hospital and its Department of Surgery have an enormously rich heritage, remarkable clinical reputation. We focus on the underserved and excellence in treatment services, as well as medical education and research. Initially established in 1852, the medical campus of Good Samaritan Hospital has been undergoing constant renovations, growth, and development, propelling it into the oldest, largest, and busiest private teaching and specialty care hospital in the greater Cincinnati area. Currently over 1 million square feet and housing nearly 600 patient beds, including 23 major and 4 minor operating rooms. The medical complex of Good Samaritan Hospital, encompassing more than a city block, has grown substantially since starting as a mere 20-bed facility. Staying at the forefront, Good Samaritan Hospital continues its mission and leadership role in promoting research and education and fostering the health and well-being of every person. As new developments in medicine and surgery arise, Good Samaritan Hospital and its Department of Surgery remain committed to making every effort to provide cutting-edge advancements and supply the necessary services to those in need as we launch a major investment in the Good Samaritan Hospital campus and our Advanced Surgical Institute. Good Samaritan will undergo an evolution in the years to come. Motivated by our mission to serve, a modernized, much-needed, state-of-the-art healthcare facility will better meet the evolving needs of the community and healthcare teams. A new ambulatory and surgical center will transform the patient experience and provide even greater access to the community by increasing the number and the size of the operating rooms, allowing room for new advanced technology and our multidisciplinary team approach to surgery. This multidisciplinary team approach to surgery is focused on the best outcome and experience for the patient. It enables the delivery of more patient-centered management and shared decision-making by a team of providers working together, each drawing on the disciplinary knowledge. As a patient facing surgery, you want the most talented team, best equipment, and safest environments. You also want the least amount of pain, best outcomes, and a chance to recover at home. This is the Good Samaritan Advanced Surgical Institute of the future, and we hope you will partner with us to make this a reality.
Already considered Cincinnati's most trusted health leader in surgical care, this new facility will transform the patient experience and provide even greater access for our community.
I have a long history with Good Samaritan Hospital. I did my general surgery residency at Good Sam, and I was excited to come back and work here when I was done with fellowship. And as I've worked here, I've been so happy to work with the people that I work with, and I feel like this is an opportunity for the facility to really complement the people, to make a state-of-the-art facility, to provide excellent surgical care, to allow us to be innovative, to use the newest surgical devices in a space that will complement that. And so I'm really excited to be a part of it, but mostly I'm excited for our patients that they're going to be benefiting from these changes. Cancer really touches all of us, and when we care for patients, we really, there's a certain level of care that they deserve. This facility is going to help support that, give us the environment where we can take care of the patients in the way that they need to be taken care of, both now and in the future. And so I'm really excited to be a part of that. A lot of what we're doing these days is what we call multidisciplinary care. So a patient will come and have a consultation and see all the different specialists that they need all in one visit. And to do that, you really need to have a facility that complements that, that's built for that and structured around that type of an interaction and encounter. And this is going to do that for Good Samaritan Hospital, for this community, and I'm really excited to be a part of that. Good Samaritan Hospital has a rich history providing excellent surgical care to Cincinnati, and for a long time now it's been in need of some upgrades to the operating rooms, and this is an opportunity for us to really enhance the operating rooms. By having this improvement, it'll allow us to be innovative, to use the best surgical devices that are available, because prior to this we maybe didn't have the space to do that. So this build is really important for that aspect as well.
Consistently among the list of what matters most to patients and their families is tailored and centralized cancer care. A single, trusted location that delivers the best physicians, caring nurses, personalized and innovative solutions, and an environment that offers hope and ease during the worst of times. This is exactly what our vision for the new cancer center will look like. Cancer is a disease that doesn't care who you are, which is why putting you at the front and center matters so much.
As we approach this campaign, one of the things that I think is most important is our ability to adapt, to change, to be able to respond to the new directions in healthcare delivery. We see this in both cardiovascular care and cancer, is that now we have to provide comprehensive services to patients. As we see cancer patients living longer, we also provide for them nutrition and behavioral health services, genetic counseling to understand their risk factors. We do this also in cardiovascular care as well. What this campaign provides us is not only a new facility to do that, but really a structure, an infrastructure to support this multidisciplinary, integrated care delivery. If I think back of all of the work that the Sisters of Charity have entrusted to us, it is our ability to adapt and change and respond in the moment to what is needed. And that's what's so exciting about this campaign. Your participation allows us not only to adapt to today, but to tomorrow as well, as we see a bright future in new developments in both cardiovascular and cancer care and medical specialties. So we thank you for your participation and look forward to partnering with you as we look to deliver the care that patients want and deserve.
The significance of this master facility plan is unlike anything in our 170-year history. The movement of core services from the Clifton Avenue focus to the entrance of the Innovation Corridor at Martin Luther King and Dick Smith Avenue is just the beginning of this project. First, let me talk about our emergency department. Although it sees modest growth in the number of rooms, the community's needs for increased services like behavioral health, our comprehensive stroke program, all benefit from this move. We also firmly believe that this new entry point into Good Samaritan Hospital will allow us to protect our patients, our physicians, team members, and visitors in a more efficient manner. Secondly, during this process, we identified the need to move our diagnostic and procedural imaging services. So not only for our emergency department, inpatient and outpatient support for MR, CT, and ultrasound, but our beloved breast center will all see an upgrade in this master facility plan. The partnership we need with our donors and community to make this happen is imperative, and I'm asking for your support. Forever forward.
This is a pivotal moment in medicine. Together with our patients, our generous donors, and talented team members, we are thinking big about the future. We are thinking forever forward. We need your help to write medicine's newest chapters.